located in the forearm. And in today's tutorial, we're going to be featuring the muscles of the anterior compartment of the forearm, many of which help to bend and flex the joints of your wrist and fingers. Before we begin, however, I'd like to give you a quick overview of what we're going to be talking about in this tutorial. So in this image here, we can see the muscles and the bones of the forearm from an anterior perspective, and that's exactly what we'll be focusing on today. We'll start off by talking about the bones of the upper limb, about the bones we can see in this illustration as they form the bony framework that our muscles attach to. Then we're going to move on to talk about the muscles of the anterior compartment of the forearm, which can be divided into two groups, the superficial layer and the deep layer. And these muscles are also collectively known as the flexors of the forearm, and as we talk about their functions, you'll see why. For each muscle we look at today, we'll learn their origin, their insertion, their function, as well as their innervation. And lastly, we'll wrap up our tutorial with some clinical notes relevant to these muscles. I just wanted to say a brief note on the brachioradialis. Some of you might be wondering why the brachioradialis is not covered in this tutorial, since it flexes the forearm at the elbow joint. Well, the reason for that is the brachioradialis is located in the posterior compartment of the forearm, and so is not generally considered a flexor muscle of the forearm. If you want to learn more about the brachioradialis, feel free to check out our video on the extensors of the forearm. Okay, so let's get started with the bones of the upper limb. So here we can see the image I just showed you, but I've just dissected away the musculature so that you can see the bones a little bit better. So this bone that we can see up here is the bone of the arm, and this bone is known as the humerus. Moving distally, we can see the bones of the forearm, which are the radius and the ulna, and next we have the bones of the hand, which can be divided into three groups. First, we have the carpals. There are 8 of these, and they're located in the wrist area. Then there are the metacarpals, and we have 5 of these, 1 for each digit. And located most distally are the phalanges, which are the bones of your digits. And as you can see, the thumb has a proximal phalanx and a distal phalanx, whereas the fingers each have 3 phalanges, the proximal, the middle, and the distal phalanges. So now that we're familiar with the bony framework our muscles attach to, let's move on to have a look at the muscles of the anterior compartment of the forearm. We'll start with our first group, which are the muscles of the superficial layer. The first muscle of the superficial layer that we're going to be talking about today is the pronator teres muscle. And this muscle has 2 origin points. The first one being the humeral head, which originates at the medial supracondylar ridge of the humerus, and the second being the ulnar head, which originates from the coronoid process of the ulna. After that, it goes on to insert here at the lateral surface of the radius. As its name suggests, one of the functions of the pronator teres is pronation of the forearm. And pronation is a movement that involves rotation of the hand and forearm so that the palm faces downwards or backwards, as demonstrated by our image here. And the pronator teres is a flexor of the forearm, therefore it also assists with the flexion of the forearm at the elbow joint. And flexion of the forearm decreases the angle between the arm and the forearm at the elbow joint. So in order for this muscle to perform its functions, it requires innervation, and the pronator teres is innervated by the median nerve, which arises from the brachial plexus. Located the most medially is the flexor carpi ulnaris. This muscle originates from the medial epicondyle of the humerus and the olecranon of the ulna. It then goes on to insert onto 2 of the carpals, the pisiform and the hamate, as well as the base of the 5th metacarpal. So when the flexor carpi ulnaris contracts, it causes adduction and flexion of the hand at the wrist joint. And as we can see in our image, adduction is the movement of the hand towards the midline of the body, whereas flexion of the hand involves decreasing the angle between the forearm and hand at the wrist joint. In terms of innervation, the flexor carpi ulnaris is innervated by the ulnar nerve, which is located medial to the median nerve. And like the median nerve, this nerve arises from the brachial plexus. Located between the flexor carpi ulnaris and the flexor carpi radialis is this muscle that we can see here, called the palmaris longus. And the palmaris longus is absent in about 15% of the population. And if you're curious, you can actually check if you have this muscle by touching the pads of your pinky and thumb while flexing your wrist. And if this muscle is present, then its tenon will be visible like you can see in this image just here. As for attachments, the palmaris longus originates from the medial epicondyle of the humerus and inserts into the palmar aponeurosis of the hand. This muscle is responsible for the flexion of the hand at the wrist joint, and it also tightens the palmar aponeurosis. So when it comes to the innervation of the palmaris longus, this muscle is innervated by the median nerve, which we can see here highlighted in green. Okay, so let's move on to look at the muscle you can now see on your screen, which is the flexor carpi radialis. And this muscle originates from the medial epicondyle of the humerus and inserts at the bases of the second and third metacarpals. So, what does the flexor carpi radialis do? Well, it's actually responsible for two movements of the wrist joint, and these two movements are contraction, which causes abduction and flexion of the hand at the wrist joint. And as we can see in our image, abduction is the movement of the hand away from the midline of the body. And the innervation of the flexor carpi radialis is supplied by the median nerve. So the next muscle we're going to be talking about is a little bit controversial. Some people say that it's a muscle of the superficial layer, while others think that it deserves a layer of its own, an intermediate layer. But to keep things simple, we're just going to class it as a superficial muscle. And the muscle I'm talking about is this one just here, the flexor digitorum superficialis. Now, this muscle originates from the medial epicondyle of the humerus, the coronoid process of the ulna, and the anterior surface of the radius. And it then splits into 4 tendons at the wrist and inserts into the middle phalanges of the 4 fingers. As always, its name gives us a clue about its functions, and flexor implies that its main function is flexion, and digitorum means fingers in Latin, so it must be responsible for the flexion of your fingers. More specifically, contraction of the flexor digitorum superficialis causes flexion of the fingers at the proximal interphalangeal joints and the metacarpophalangeal joints. And flexion or bending of these joints allows you to carry out various activities like playing guitar, for example. And the flexor digitorum superficialis is also responsible for flexion of the hand at the wrist joint. In terms of innervation, the flexor digitorum superficialis is innervated by the median nerve. So now that we talked about the superficial muscles of the anterior compartment of the forearm, let's dig a little bit deeper and take a look at the muscles found in the deep layer. The first muscle of this layer that we're going to be talking about is the flexor digitorum profundus. And this muscle originates from the anterior margin of the ulna and the interosseous membrane of the forearm. At the wrist, it splits into 4 tendons that insert onto the distal phalanges of the 4 fingers. When the flexor digitorum profundus contracts, it causes flexion of the fingers at the distal interphalangeal joints and the metacarpophalangeal joints. It is also responsible for flexion of the hand at the wrist joint. The innervation of the flexor digitorum profundus is supplied by 2 nerves. The medial half of this muscle, which moves the pinky, and the ring finger, is innervated by the ulnar nerve, whereas the lateral half, which moves the middle finger and the index finger, is innervated by the median nerve. Lateral to the flexor digitorum profundus, we can see this muscle here, which is called the flexor pollicis longus. And in terms of origin points, this muscle originates from the anterior margin of the radius and the interosseous membrane of the forearm. It then goes on to insert at the distal phalanx of the thumb. And this muscle is responsible for flexion of the thumb at the interphalangeal and metacarpophalangeal joints. So when it comes to the innervation of the flexor pollicis longus, this muscle is innervated by the median nerve, which we can see here highlighted in green. And if we move the flexor digitorum profundus and the flexor pollicis longus, we can see the last muscle of the deep compartment, which is the pronator quadratus. And this muscle originates from the anterior surface of the ulna and extends horizontally to insert onto the anterior surface of the radius. So what does the pronator quadratus do? Well, as the name suggests, this muscle works with the pronator teres to perform pronation of the forearm, and the innervation of the pronator quadratus is supplied by the median nerve. Okay, now that we're familiar with the muscles of the anterior compartment of the forearm, let's get clinical. So you may have noticed that most of the muscles we saw today extended from the forearm into the hand. And as they do this, some of these muscles pass through a structure known as the carpal tunnel. And if we take a look at this image here, which is an MRI scan of the wrist in the axial plane, we can see that this tunnel is formed by the carpal bones and a band of fibrous tissue known as the flexor retinaculum. And the contents of the carpal tunnel include the tendons of the flexor pollicis longus, flexor digitorum profundus, and flexor digitorum superficialis, as well as the median nerve. And compression of these structures, specifically the median nerve, can cause carpal tunnel syndrome. And this is usually as a result of swelling, but the cause of this condition is often idiopathic or unknown. However, individuals are more at risk if their work or hobbies require repetitive motions of the wrist, if they have conditions like hypothyroidism, obesity, rheumatoid arthritis, and diabetes, or if they are pregnant. Symptoms include pain in the fingers, hand or arm, numbness of the hand, pins and needles, and weakness of the thumb or difficulty gripping. And symptoms normally start slowly, are intermittent, and are usually worse at night. Carpal tunnel syndrome can resolve by itself, and treatment usually takes a conservative approach. It involves wearing a wrist splint to relieve pressure on the nerve and rest and pain medication. If this doesn't work, then a steroid injection might be required, and if all other treatments are proven insufficient, surgery may also have to be considered. And it usually takes about 1 month to recover from surgeries and get back to normal activities. So before we bring our tutorial to a close, let's quickly summarize what we've learned today. So we started our tutorial with the bones of the upper limb, which are the humerus, the radius, the ulna, the carpals, the metacarpals, and the phalanges. We then moved on to the muscles of the anterior compartment of the forearm, which we divided into 2 groups, the superficial layer and the deep layer. And for each muscle, we discussed their origin, insertion, function, and innervation. Lastly, we concluded our tutorial with some clinical notes about carpal tunnel syndrome. And that brings us to the end of our tutorial on the muscles of the anterior compartment of the forearm. I hope you enjoyed it. Thanks for watching, and see you next time.
Hello everyone, this is João from KenHub, and welcome to another anatomy tutorial where this time we're going to be covering the posterior compartment forearm muscle. So what we're going to essentially do on this tutorial is look at this image that you see right now, which is the posterior side of the arm, as we were looking at the anatomical position of the arm, and then looking at the back of your arm and seeing these muscles that you see here. And we're going to be describing them, not only being able to identify these muscles, but also talking about their origins, insertions, innervation functions, and a little bit of related clinical anatomy. Now, the posterior compartment of the forearm is divided from the anterior compartment of the forearm muscles, which, by the way, there is a tutorial here at KenHub that you can watch and learn about the muscles that you find on the anterior compartment of the forearm. And these 2 compartments are divided by deep fascia, the lateral deep intermuscular septum, and the interosseous membrane between the radius and the ulna. First thing I would like to say about the posterior compartment forearm muscles is that they can be divided into 2 categories or 2 groups. One of them is known as the superficial muscles, or a superficial layer of muscles. You also find a deep layer, or the deep muscles of the posterior compartment. Now, we're going to start off with the very first one here on the list, which I'm going to isolate here. Notice the image. I just erased the deep layer so I can just isolate the superficial muscles of the posterior compartment of the forearm. And as I mentioned, these will be then 6 muscles, which include the brachioradialis, the extensor carpi radialis longus, the extensor carpi radialis brevis. And keep in mind that these 3 muscles sometimes are divided into a separate group, which is known as the radial group, or the radial muscles of the forearm. And if you notice here on KenHub, we have a separate tutorial and a separate quiz which will deal with these muscles separately. But you can also talk about them as part of this superficial layer as well. The other 3 muscles will then be the extensor digitorum, the extensor digiti minimi, and the extensor carpi ulnaris. Now, the easiest thing to learn about the superficial muscles of the posterior compartment of the forearm is that they're all going to be innervated by this nerve that you see here highlighted in green on this image of the forearm. And keep in mind that right now we're looking at the arm from an interior view of the anatomical position, but the nerve is going to course to then the posterior side of the forearm, where it's going to be then innervating this group of muscles. And this nerve is then the radial nerve. And now that we know that, we're going to now talk about the different origins, insertions, functions, and a little bit of clinical anatomy later on about the different muscles that I listed before. And we're going to start off with this one that you see here highlighted in green. And also we're looking at an anterior view of the forearm here. But of course, if you were to look at the posterior view, you also see this muscle, which is the brachioradialis. And this powerful muscle is mainly responsible for the lateral contour of the elbow and forearm. In terms of origin points, it's going to be originating from the lateral supracondylar ridge between the brachialis and the lateral head of the triceps muscle. And you notice here that this would be the lateral supracondylar ridge of this bone here that you see partially, which is the humerus. Another point of origin for the brachioradialis is the lateral intermuscular septum of the humerus. Now the muscle is going to go all the way distally to then insert at the styloid process of the radius, as you can see here on this image. And notice that the radius should be found in this direction, while the ulna is going to be found right next to it, a little bit more medially. Now you can see that the radius is covered by this layer of muscles, which are the muscles of the interior compartment of the forearm. But here you see a little bit of the styloid process of the radius, where the brachioradialis is going to be inserting. The next thing that we're going to be covering about the brachioradialis, and you can see here now the muscle in action, and this is going to be then the functions or actions associated to the brachioradialis. The brachioradialis acts on the elbow joint to flex the forearm when the arm is semi-pronated. The next muscle that we saw on that list is now seen here highlighted in green, and now we're looking at a posterior view of the forearm. The highlighted muscle is then the extensor carpi radialis longus. And the majority of this muscle will be lying underneath the brachioradialis, the muscle that we talked about before. Now, in terms of origin points, it has an origin slightly below the lateral supracondylar ridge of the humerus, which you can also see here. The muscle will go then distally to insert at the posterior side of the base of the second metacarpal bone. Notice here, this is the second metacarpal bone, and the base would be a bit proximal here, and this is the insertion point for the extensor carpi radialis longus. Moving on to now the actions associated or functions associated to the extensor carpi radialis longus. As you see now here, this image of the muscle in action. This muscle, when contracted, aids in movements within the wrist joint, such as dorsal extension when it's fist closure, and abduction or radial deviation of the hand. So basically this movement that is represented here by this arrow, when you move your hand to the lateral side, to the side of the radius, this is why we call it also radial deviation. We're moving on to the next one. This scene here highlighted in green is now known as the extensor carpi radialis brevis. This one is shorter and thicker than the extensor carpi radialis longus. And this one will be arising from the common extensor tendon of the superficial extensors at the lateral epicondyle of the humerus, as you can see here. One important clarification, one important point that I wanted to make here on this tutorial, that sometimes these muscles of the posterior compartment are also referred to as extensors of the forearm. So sometimes the superficial group is also known as the superficial extensors of the forearm, as the deep group is also known as the deep extensors of the forearm. Now that this clarification is made, we're going to move on now to the insertion point of the extensor carpi radialis brevis. And this muscle will be attaching to the posterior side of the base of the third metacarpal bone, as you can see here. So this is the base of the third metacarpal bone, or the bone that is in direct connection to then the middle finger. Now also a word on the different functions or actions associated to the extensor carpi radialis brevis. And like the longus, this muscle is also a weak flexor of the forearm at the elbow joint. And when contracted, it will also help with movements within your wrist joint, namely then extension and also abduction of the hand, also known as radial deviation, which you see here represented by this arrow. So when you move your hand to the lateral side or towards your radius, that's why we call it also radial deviation, because there is also ulnar deviation, which is when you do the opposite movement. We're now ready to move on to the next muscle that you see here highlighted in green. This one is known as the extensor digitorum. This muscle will be originating from the lateral epicondyle of the humerus, which is this area here of the bone, and you notice where the muscle is originating from. Then as you can see in terms of insertion points, you notice that the muscle will be dividing here distally into 4 tendons, or 4 smaller tendons, which insert at the posterior surface of the middle and distal phalanges of the second all the way to your little finger or the 5th finger. And notice here that these are the middle phalanges, and these will be then the distal phalanges. And notice how the muscle is attaching in these areas of your digits. We're going to move on to then the functions or actions associated to the extensor digitorum. This muscle's contraction will cause a dorsal extension at the wrist joint, as you can see represented by this arrow and the movement that you see here on this image. So this is dorsal extension at the wrist joint. And furthermore, the extensor digitorum has a role in extension of several joints, including the metacarpal phalangeal, the proximal interphalangeal, and distal interphalangeal joints of the 2nd to 5th fingers. And if I use this image here, I can show you that the metacarpal phalangeal joints are found between the metacarpal bones and the proximal phalanges. And the proximal interphalangeal joints will be then found between the proximal phalanges and the middle phalanges of the fingers. And of course, the distal interphalangeal joints will be found between the middle phalanges and the distal phalanges of the fingers. And these will be then moved or extended by the extensor digitorum. And due to the fact that its insertion tendons are partially connected to each other through the dorsal aponeurosis, when one finger extends, it will simultaneously lead to slight extension of neighboring fingers. Next muscle that we're going to be talking about that you see now highlighted in green, this is the extensor digiti minimi. And the extensor digiti minimi is a slender muscle of the forearm and will be originating from the lateral epicondyle of the humerus, as you can see here. The muscle goes all the way to then insert on the dorsal aponeurosis of the little finger. Its muscle belly often blends with the extensor digitorum. As for the functions or related actions to the extensor digiti minimi, this muscle will be able to cause extension at the wrist joint as well, and also extension of the little finger, as you can see here. And this all has to do with the fact that this muscle will be inserting on the dorsal aponeurosis of the little finger. So when contracted, it can cause that extension of the little finger. The next muscle that we're going to be talking about, now seen here highlighted in green, is known as the extensor carpi ulnaris muscle. And the extensor carpi ulnaris is a skeletal muscle that is located on the ulnar side of your forearm. And you can see here now clearly on this image, this is part of the ulna, as you can see a bit behind the muscle. And this would be then the radius. It has its origin point at both the lateral epicondyle of the humerus, which you see here. You can also say that the muscle has two heads, and one of the heads will be originating from the lateral epicondyle of the humerus, while the other head, which is known as the ulnar head, will be then originating from the posterior surface of the ulna, as you can see here. Now the muscle goes all the way to then insert at the base of the fifth metacarpal bone, as you can see here on this image. This is the fifth metacarpal bone, and the base of the bone is found right about here, where then the muscle will insert. Now we're moving on, talking about the different functions or actions associated to the extensor carpi ulnaris, and you see two images here of the muscle. The one on the left shows the muscle contracted, while the one on the right side is showing just the muscle with no contraction. And as the name suggests, extensor carpi ulnaris, meaning that it's going to extend the wrist, this muscle is also responsible for extension at the wrist joint, which you see here represented by this arrow. And in addition, the contraction of the extensor carpi ulnaris will pull the hand medially on what we call ulnar abduction, which I mentioned before, and you see here represented by this arrow. So when you move your hand towards the medial side of your body or towards your ulna, and this is what we call then ulnar deviation as well. Now, as I promised, we're going to have a little word on related clinical anatomy related to then the superficial muscles of the posterior forearm. And due to incomplete migration of the forearm muscles during embryogenesis, approximately 2 to 3% of all people have what is known to be as a little brother of the extensor digitorum, which is known as the extensor digitorum brevis manus. And this accessory muscle is normally harmless, but can compress the interosseous nerve during hypertrophy. And this will then cause pain in the wrist joint. We're now ready to move on to the next group, and right now I'm showing you all the muscles of the posterior compartment, but I'm going to isolate now the deep muscles of the posterior compartment, also known as deep extensors of the forearm. Now these are 5 muscles that I'm going to list now: the supinator, the abductor pollicis longus, the extensor pollicis brevis, the extensor pollicis longus, and the extensor indicis. Now another easy thing that we need to remember here is that all these muscles will be innervated by this nerve that you see here highlighted in green, and if you remember well, yes, this is the radial nerve. And knowing that, we're going to move on to the very first one on the list here that you see highlighted in green. This is known as the supinator muscle. And the supinator is a broad muscle in the posterior compartment of the forearm that is curved around the upper third of the radius, as you can clearly see here on this image. Now, in terms of origin points, it has a complex origin tendon arising from 4 places. One is the lateral epicondyle of the humerus. Another one will be the radial collateral ligament, the annular ligament of the radius, and another origin point will be the supinator crest of the ulna, as you can see here on the image. Now the muscle will then be inserting around the radius on the posterior surface of the radius. In terms of functions or actions associated to the supinator, you can see it here in action. And the name says it all. The function of the supinator is to pull the radius, causing then lateral rotation of the radial-ulnar joint. So as you ready to move on to the next muscle that you see here highlighted in green. This one is the abductor pollicis longus. And this muscle has 3 origin points that you need to remember. One being the posterior side of the radius. The other one being the posterior surface of the ulna, which you can clearly see here. And the other one will be then the interosseous membrane, or a membrane, as the name indicates, interosseous, meaning between bones, a membrane which you should find between the radius and the ulna. And this muscle will then be originating from the interosseous membrane. The abductor pollicis longus will go all the way to then insert at the base of the metacarpal bone of the thumb, as you can see here. Often the insertion tendon splits into two and additionally attaches to the trapezium, which you can also see here, the trapezium bone. Now, when we talk about different functions or actions associated to the abductor pollicis longus, and the insertion points told us a lot. The abductor pollicis longus will be pulling the thumb forward at the saddle joint, or the joint between the trapezium and the first metacarpal bone. This movement is what we would call then abduction, which leads to also a lateral movement of the radius at the wrist joint at the same time, which is called then radial abduction. And you can see these movements indicated by this arrow here. We're now ready to move on to the next slide, the next muscle here. This one is going to be then the extensor pollicis brevis. And this one is found also on the dorsal side of the forearm, as you would expect. And in terms of origin points, it begins more distally at the posterior side of the radius, which you can still see here from this image. And also that membrane that we talked about before that you see now here on this image, this is the interosseous membrane, and you can see how it originates from the interosseous membrane of the forearm. Now the extensor pollicis brevis muscle is going to then insert at the base of the proximal phalanx of the thumb, as you can see here. Based on the name, you could guess a bit on the functions or actions associated to the extensor pollicis brevis. The extensor pollicis brevis will be causing extension of the thumb in the saddle and metacarpal phalangeal joints. And these joints can be also seen here. So this is the saddle joint between the trapezium bone and the first metacarpal, and the metacarpal phalangeal joint of the thumb, which is found right about here, between the metacarpal bone and the proximal phalanx of the thumb. And you can see this movement indicated here by this arrow. This also leads to radial abduction of the wrist. Moving on to the next muscle on our list, this one that you see here highlighted, it is the extensor pollicis longus. And this muscle arises medially at the posterior side of the ulna, as you can clearly see here on this image. And another origin point will be the membrane that I talked about, the interosseous membrane, which you can also see here on this image, which can serve as well as an origin point for the extensor pollicis longus. When it comes to the insertion point for this muscle, it will be inserting at the base of the distal phalanx of the thumb, as you can see here. And there at the insertion point, it will form the dorsal aponeurosis, covering the thumb medially, laterally, and also dorsally. And this sheet-like tendinous expansion will serve mainly as an insertion point for muscles and also some of the ligaments. The extensor pollicis longus extends the thumb at the metacarpal phalangeal and interphalangeal joints of the thumb, and also weakly extends the hand at the wrist joint. The next muscle that we're going to be covering is seen now highlighted in green. This is known as the extensor indicis, and in terms of origin point, the muscle is going to then originate from the posterior side of the ulna, as you can clearly see here on this image. And also the interosseous membrane will be serving as a origin point for the extensor indicis. Now the muscle goes and then inserts distally at the dorsal aponeurosis of your index finger, as you can see here. Now in terms of functions or actions associated to the extensor indicis, the name says it all, extensor of the index finger. So the extensor indicis pulls the index finger while causing then extension at the metacarpal phalangeal joint, the proximal interphalangeal and distal interphalangeal joints, as you can see here represented by this arrow. And keep in mind that the metacarpal phalangeal joint is found here, just between the metacarpal bone of the index finger and also the proximal phalanx of the index finger. The proximal interphalangeal joint is found right about here between the proximal phalanx of the index finger and also the middle phalanx of the index finger. And the distal interphalangeal joint is found just right here between the middle phalanx of the index finger and the distal phalanx of the index finger. So when this muscle contracts, it's going to be able to extend all of these joints. Contraction of this muscle can also lead to extension of the hand. And now that we covered all the muscles, I would like to talk a little bit about the different clinical aspects, or one clinical aspect related to the deep muscles of the posterior forearm. Now, the narrow course of the deep branch of the radial nerve between the two layers of the supinator muscle will carry a high risk of entrapment. And this is a condition referred to as the supinator syndrome. And since the deep branch of the radial nerve supplies the extensors of the forearm, the affected patients will then additionally exhibit what is known to be as weakened ability to extend the hand and also their fingers. Now, a bit of a fun fact here on this image, that if you extend your thumb, as you see on the image, you see this triangular depression just below the tendons. This is what we call anatomical snuff box or radial fossa. The anatomical snuff box is going to be framed by the radius, as well as both tendons of the extensor pollicis longus dorsally and the extensor pollicis brevis on the palmar side. There are two clinical significance related to this structure that I would like to add here on this tutorial. If you palpate the anatomical snuff box, you can feel the pulse of an important artery, the radial artery, because it runs in this region. Also, the anatomical snuff box is used to palpate or feel the scaphoid bone as a quick way for diagnosing a potential scaphoid bone fracture.